given that extensive journey that you had and learning experiences throughout undergrad, what were some of the big takeaways, if any, that you had?
So you highlighted a point that goes right into my first takeaway about, I had a vision of being a doctor, and then I had these other interests that were coming to earth. So I think the first takeaway is be skeptical about making rigid prescriptions about who you are and who you will be early on. I think it's important to allow ourselves to encounter failure. The second piece I would say is recapture that childlike sense of awe. And for me, I've always been a geek, nerdy into technology, nerdy into science, nerdy into the way the brain works. So I think it's important to also study those fundamentals that build on top of everything, like computers, microeconomics, persuasion, psychology, ethics. And the third thing I would say is if you can feasibly travel abroad, whether that's for study abroad, whether that's for leisure or any other reason, definitely do it. I wouldn't think twice.
I couldn't agree with those points and anymore. And I think like too often, especially early in our careers, we have that rigid plan or rigid thought of, okay, this is what it's going to be. This is what it's going to be. And it comes from a place of like maybe not always understanding what are the options, what are the experiences that you really need to know this is actually the thing that need or that I want to do. And I feel like that's why one of the reasons I started this podcast is just like to share more about public health careers so that people can find out about it before they're 23 like me, and like just be a little more intentional in that path into public health, which I think is important.
It is. It's important. It's beautiful to see that you took the journey you went through and now you're providing a solution to that. Like I always think about as I've been listening to your podcast, I wish I would have listened to this when I was 13 or 14 because it would have changed everything for me. So again, it's beautiful to see how your platform is really providing such a necessary service for people that want to come into healthcare and make a difference.
Yeah, yeah. Well, I appreciate that, and that I wish I had it as well because it would have saved me a lot of time and a lot more direction and get into where I am today. But our journeys are our journeys, and
Right.
those experiences and misdirections are important and like kind of define who we are. So can't complain.
Agreed.
And after your bachelor's degree, you decided to pursue a master's of public health at Tulane University School of Public Health and Tropical Medicine. So, what was the process going into here? How did you know that like a master's in public health was something that you were interested in? Kind of tell us maybe that thought process of learning about public health and then deciding to go into an MPH program.
hmm That's a great question. So, back in 2016, when I did go to Spain, I was shadowing doctors. It became more of being immersed in a public health system in Spain. Taught me a lot about like why is this so different than America? And 2018, after I graduated undergrad, and I was taking that gap year, and I went to Kenya. I had the same realization, and so I said, this is another way to transform health. There's not just medicine, because that's everything that I saw and that was preached growing up was you have to go through medicine. And so when I was in Kenya, my initial thought was that seeing that there was such a need for medical devices, I would join a medical device company that had a public and global health initiative that would allow me to go back and provide the necessary supplies that they needed. So that led me to join Medline, where I ultimately was there for over 3.5 years. But during that time span, it was a little bit different than what I thought it was. Again, that goes back to not making those early prescriptions. And 2020 came naturally with COVID going on. That just told me that's the signal to go and study public health. Like I've had these experiences. I keep finding myself in these situations where I'm discussing populations, I'm understanding different way people behave and why they do the things they do. This is it. So I saw that Tulane also offered courses in social innovation. and entrepreneurship and health equity, social and behavioral health sciences, things that I love. So to me, it was a no brainer. I connected with a recruiter about the application process. And this is also a shameless plug to Tulane. There was no GMAT required. So that was also a big guiding factor. I didn't have to take an entrance test. It was just based off of the application process. And I think that, while the coursework and everything was great, and the professors were incredible, that I saw that Tulane also had a Change Maker Institute, which is a social venture accelerator program, which, that in itself, being able to be surrounded by a group of visionaries that want to build and develop different services and businesses and interventions that impact healthcare, society abroad, that ultimately drew me there, where I spent my next 2 years.
And I love hearing the going to Kenya, learning about like the gap or the need for medical devices, and kind of like thinking about things from that perspective, while also thinking about, okay, how can I get this master's of public health? But I don't only want to learn about public health. I want to learn about this social innovation type of things, and finding a school that kind of match with that. I think is important. And too often we kind of limit ourselves, or maybe we don't reflect enough to think about what are all the things that we do want in a program. And I think, especially in this economy, you have to be very intentional in this kind of
Yes.
investment, and really, really understanding what are all the factors that make this program the program that's going to make me or give me the best opportunity to be successful going forward. I think is so important. And even in you like knowing about this, you didn't know about the Changemaker Institute, and like just you still were able to go in there, learn, build, and just see and build, I guess, more of an ecosystem around these public health tangential, or like things that intersect with public health in a way. So I think that's really cool for you to highlight.
No, I really appreciate that. And I think you said it best is I was always searching for this ecosystem. I wasn't just looking for like a point solution, like just one rigid way to make a difference, because the way the world is going, there's so many different aspects that intersect. And why not bring that to public health if we're going to be responsible for taking care of populations at large?
And maybe what were some of those innovative maybe thought processes or lens that you kind of like gained while you were in your MPH program and kind of like part of these different communities?
I think the one thing is how technology can accelerate innovation. I think we all know historically healthcare is very slow to adopt new technologies, but I think COVID kind of became the accelerant for that.
And I appreciate you sharing all about your MPH experience. What were some big takeaways that you would want to share with us?
There's two. I think the first one is unapologetically discover the intersection of your interests. For me, it's the blend of healthcare, technology, and behavior design. For someone else, it's something different, and I think you should explore that. The second thing is to find professors, mentors, and peers that'll challenge your thinking and seek out the right questions rather than the right answers. I think it's easy to get caught up in the idea that we need to have answers to anything, but with the right questions, it can put you in positions and opportunities that you never even thought about before.
And then coming out of your Masters of Public Health program, like what was your thought process on what the next steps of your career ideally would have looked like?
I when I came out of the program, I knew that I wanted to work in a health tech company. I knew whether it was going to be somewhere like GE or somewhere where there's a huge footprint, or either a small early stage startup. I knew that was the direction I wanted to go. So I spent a little time reflecting on why I love Tulane so much. And it was because of that small cohesive group. And to me, I was looking for that challenge to grow myself and honestly kind of get an MBA on someone else's dollar. So I decided to join MyndYou, which is what at the time was a very early stage startup. less than 30 people, maybe even less than 20 at the time. And it's been a life-changing experience, being able to be surrounded with a group of technologists, a group of clinicians and public health practitioners, all under the same virtual roof.
Yeah, absolutely, and I know we've had one of your coworkers, Tali Sagev, on a previous episode. I'll be sure to link that episode in the show notes for anyone that's interested.